Okay, this video is currently probably the last video in a series of uh, videos about weight loss in the VLCD, at least for today. And it is about medications for weight loss, prescription medications for weight loss. And I'm going to touch on several medications in this video, and I may have further videos about individual medications in the future, but I'm just going to kind of give a general overview about each medication and at least my opinions on the medications. So first one is phentermine. That's one of the oldest ones that we have, and it is tried and true. It's a stimulant, and we currently are approved to use it 3 months on and 6 months off. The problem with that is that it helps you. It could be used as a jump start, but then when your 3 months is up, you're kind of in trouble again because your hunger comes back. All it does is it gives you energy and it suppresses your appetite, so people don't feel as hungry on the medication. Phentermine has, which is also known as Adipex, has the potential to have what we call tachyphylaxis, where at any dose you can become resistant to it. The next medication I'm going to talk about is called Qsymia. It's a combination of phentermine or Adipex and Topamax, which Topamax we use for migraines, we use it for seizures. It's an old long-standing medication that we have used for many, many years. This uses a longer-acting phentermine combined with Topamax. Topamax, we find that people don't use or don't feel as hungry on that medication. And some people have lost weight on it when they're on it for other reasons. So it was studied and put in combination with a longer acting phentermine that kind of is a sustained release. And the FDA did approve the combination of the two to be used long term, not only for weight loss, but for weight loss maintenance. So that is a wonderful thing because we know that obesity is a chronic disease and it needs to be treated long term. So I'm very happy with that revelation that has occurred. So we do have several drugs now that can be used long term, which is a very, very big necessity. So the combination drug I'm very happy with. I do have a lot of success with that drug and a lot of patients. So but having said that, I do want to emphasize the fact that no drug is a miracle. Absolutely no drug. I will never ever even prescribe a drug without having lifestyle change in a patient. So they need to go on a program, a lifestyle change program first before I will even prescribe a drug. Because if there was a miracle drug, it would be out there and I would be telling you about that and nothing else, but it just doesn't exist, unfortunately. So I'm not going to set anyone up for failure by letting you think that there is. So I always put someone on a VLCD or a modified VLCD type program so that they have the tools for success before I put them on a medication. And then it does definitely help them. So Qsymia is a very good one to help with that. And it's very individualized which drug is best for who, but that's one of my top drugs. Saxenda is the next one, which is probably my very top drug. I think it works extremely well. It's a GLP-1 inhibitor drug that works. It's an injectable drug. You use it once daily, and it works. I'm sorry, I was misspeaking. GLP-1 receptor agonist is what I meant to say, but it works in 3 locations in the hypothalamus of the brain by by suppressing your appetite in your brain itself. It works in the gut by slowing gut transit so that you feel full more quickly. And it also works in the pancreas, which, if you're listening to my other videos, you know is a big deal. Your alpha and beta cells in your pancreas, which controls your insulin production and also your glucagon production. So it prevents your liver from producing its own sugar and your insulin from causing you to store fat and slow down your metabolism, store sugar into fat. So it works beautifully. And I actually find in patients that when they're on this, even if they do stray a little from what they should be doing, it helps them not to gain weight from that little tiny mistake that they've made if they're not being as good on their program as they should be doing. So it's a wonderful drug. The problem with it is the cost, and I'm hoping that eventually we will have some relief with cost on Saxenda and have some other drugs similar that will help. Then we also have Belviq, which works in the serotonin agonist, and it's a serotonin agonist and works kind of like the antidepressant type mechanism, like an antidepressant type of mechanism, but tends to make you full more quickly. I haven't had so much success with that. And Contrave, which works. I was really hopeful for Contrave when it came out because it's focusing on addiction as the cause. It has naltrexone in it as well as bupropion, and bupropion is what we use to help people quit smoking, and naltrexone to help people with narcotic addiction. And it's really focusing on the addiction of eating, and I really, really was hopeful that that was going to be the answer. But nausea has just been horrifyingly a huge issue for me with that drug. I haven't had many people be able to tolerate it or do very well on it. So I haven't been feeling too it's too promising of a drug. I was just looking to make sure I'm kind of covering all of them. Some people really want to do thyroid replacement, which I highly recommend against because of the side effects. Your thyroid needs to be where it needs to be. It needs to be euthyroid. You don't use thyroid being overactive, which is a disease state, to make you lose weight. That is not appropriate. It causes heart rhythm problems. It causes osteoporosis. You need to keep your body in line with where it's supposed to be. Other people want to use HCG, which is also completely inappropriate. There's absolutely no data whatsoever to support HCG as a weight loss product. So you can forget that. People who've gone on HCG programs and lost weight, that's because they were doing the VLCD with the HCG. The VLCD has the data, not the HCG. Your HCG was giving you a placebo effect. So I think that covers the majority of the drugs that are of question. If there's anything else, you can always let me know, and I will let you know what I think of it. Thanks. Bye-bye.